亲爱的观众朋友们，大家好，欢迎收看由贝妮为您主持的华语一周。今天来到我们节目做客的是 MORE Health 爱医传递的首席医疗官 UCSF 肿瘤科的教授兼主任 Dr. Marc Shuman. Welcome, Dr. Shuman.
Thank you. It's a pleasure to be back.
Dr. Shuman, today we're going to talk about telemedicine. So what is telemedicine?
Yes. Telemedicine is a system whereby physicians in one city or a country can give consultations to doctors in another city or another country.
So what kind of patients will benefit most from this kind of consultations?
Yeah. The kinds of patients that are best served by this process are complicated patients, patients with serious diseases that require a great deal of expertise. For example, consultants who, although the disease may be rare, have a lot of experience with it and are highly specialized. Patients who also require the newest treatments can get advice or consultation by doctors in a country where these drugs are developed and tested.
And there's a problem here. The doctors in two different countries, they speak different languages. So how do they communicate with each other?
That's a great question. And it's best accomplished by having an interpreter who is fluent in both languages, which is very important, and also has an experience in medicine. The interpreter doesn't have to be a doctor, but it needs to really be a health professional, someone who's familiar with the terms, including laboratory results and things like that.
And how are these consultations helpful to the doctors and patients in China?
Well, one of the most helpful things is when it's very difficult to make a diagnosis. Many patients have very complex problems or diseases, and the doctors, let's say in China, may not have a lot of experience with diagnosing or treating that disease. So that doctors in Western countries with more experience are able to give a consultation that can suggest other tests that could be done to make the diagnosis, including x-rays or blood tests. Another advantage of telemedicine is the knowledge of the newest drugs, newest types of surgeries, the newest types of devices that might not be available, that knowledge might not be available in another country. So for example, if a cardiologist, a heart doctor in China is taking care of a very complicated patient, there may be new cardiac devices that have been tested in the US that could be applied for this given patient.
Is there any other benefit of these kind of consultations?
I think the benefit is when we have complex diseases where we need more than one consultant. Because these difficult cases may involve infection, it's difficult to treat with antibiotics and other types of problems. Telemedicine can provide multiple consultants.
So how does the patient's doctor in China find the best consultants for them?
Yeah, that's an excellent question. And it's sometimes very difficult for the doctor in China. Generally, I think doctors in China or other countries look for the most famous doctors. But the most famous doctors aren't necessarily the best doctors.
Right.
For example, some very famous doctors in the United States no longer practice medicine. So they're not up to date in the latest treatments. they probably achieved their fame maybe 10, 15, 20 years ago, but they're not currently practicing.
Right.
So we have to look for better indicators of the best consultants. One is to look at the position of that consultant in the medical center where they're practicing. Is that consultant a leader at that medical center? Do they chair the department? Another important characterization is, do they hold national office in professional societies in that disease? For example, there's an organization, the American College of Cardiology. So one would ask, is that consultant an officer, a president or vice president? A third criteria is, how good is the medical center where the doctor is practicing? The doctor may be the most famous oncologist at that hospital, but the hospital may be small and not very good. So generally, you're not going to want a consultant in that situation. Generally, you want a consultant who's at a top-ranked hospital in the U.S. Using standard criteria. Another aspect of this is, has the consultant written articles in Western journals on how to manage these problems? This is, again, an outstanding way of telling whether this is going to be the right consultant.
Thank you. And how does this whole consultation process actually work?
Okay. It involves the consulting doctor getting all the records of the patient. And obviously, the records need to be translated from Mandarin into English.
Right.
The doctor, consultant here, needs to have the results of the blood test translated to English. And the doctor needs to see all of the x-rays and see them in the same way that a doctor in the U.S. would look at their own patients' x-rays. So they're transmitted electronically. And this applies also to the pathology, where the doctor consultant in the U.S. can actually look at the microscope slides. So it's a somewhat complicated process, but it can be much easier when this service is well experienced.
Thank you, Dr. Shuman. Thank you for introducing telemedicine to our audience.
It's my great pleasure, and I enjoyed talking with you.
好了，我们休息一下，不要走开。广告之后马上回来。